right, good evening, everybody. We are live. It's officially summertime. It is, let's see, man, it keeps time's flying by, June 9th. It is Tuesday night, and we're live from Ikaria Concierge and Functional Medicine. And today we're excited to talk about one of the things that we've been excited about for a long time, and that is stem cells. I mean, it's a hot topic. It's been around for a while. There seems to be a more open and permissive environment with stem cells, which can make it exciting, make it feel very exciting, but also potentially scary, given the fact that, I think consumers have a lot to choose from, and we're not really sure, what's what, and who might benefit, who may not, who may not benefit, and what it all means. And so we kind of want to shed some light on the topic and go over a lot of different questions that people might have, starting with what stem cells are, what they're potentially used to treat, who might be a patient, what is the likelihood of potentially getting better, and then are there reputable companies out there that have been in existence for a while, and then is there a program that you can develop that might benefit patients. And so we're going to start by just talking about what stem cells are, and then go from there. But before we do that, I'll introduce my
thank you.
wife,
Hi,
Dr. Felice Hockney. Good to
Hi,
see
everyone.
you live from Vero.
I like this topic because, first of all, we get questioned about it constantly in the office. People don't really understand. It falls under kind of an umbrella of medicine called regenerative medicine. It's really interesting. There's some controversy that surrounds it. We'll explain a little further on that. But like you said, a lot of the regulations are loosening, thank God, because it really is a therapy that truly helps people. And I'm excited to talk about it because I'm going to pick your brain, because I know you know a lot about it. Sort of just, you've been doing it a long time.
A lot is relative. It's always a relative term. Of course, the more you learn about something, the more you realize you don't know. But
I know.
Yeah,
this
we'll
is
try to shed some light on some terminology and some things that we've learned along the way, and hopefully provide some useful information to our listeners and consumers at large.
Yeah, and the way we decided to do this podcast tonight was we are going to Denver next week for a really big regenerative medicine conference, and it's going to be amazing. So we thought, well, might as well kind of brush up on all of it for ourselves and for our listeners.
Yeah, and it's put on by two groups. One is a group called Regenexx, which has been in existence since 2005. We'll talk about them a little bit more. I think they've got a really, really good program. And then the International Organization of the International Orthobiologics Foundation, IOF.
It's a mouthful.
And it is a mouthful, the IOF, and they go over a lot of different ultrasound guided technologies, fluoro technologies, to make sure that we're establishing the correct diagnoses in patients. And then when we actually do harvest stem cells, we're actually placing the stem cell in the right location, which is obviously hugely important. But,
okay, so just to get started, just start from the basics. What is a stem cell? What is it exactly?
Right. And I think for the sake of this discussion, we'll talk about autologous.
Okay.
What autologous means is it comes from yourself. So we are harvesting stem cells from the actual patient. So a patient comes in and they've got osteoarthritis of the knee, or they've got osteoarthritis of the shoulder, and they want a regenerative therapy, and we're going to harvest autologous stem cells. That means we're harvesting that patient's stem cells. So autologous,
Gotcha.
yeah. And what a stem cell or an autologous stem cell means, you can get them from bone marrow, you can get them from fat, you can get them from even the blood. Mm-hmm. And what a stem cell means is that it can do three things. It can survive on its own once you pull it out of its microenvironment. It can reproduce into itself, so it can form another cell like itself, and then it can move into progenitor cells. So specifically for the topic of things like inflammation and osteoarthritis, and treating those kinds of things, the stem cell can differentiate into an osteocyte, which is a bone cell, a chondrocyte, which is a cartilage cell, a myocyte, muscle cell, tenocyte, adipocyte, which is a fat cell. So literally are basically different types of cells, and specifically with regard to mesenchymal stem cells, those are the main cells that we're concerned with as far as them differentiating into. So, but those are the three big things.
I always kind of thought, I remember being in med school and learning about stem cells, and at the time it was a big to do, if you remember, because they were really only getting them, they were embryonic.
Correct.
In origin, and so there was a lot of controversy over that. Now you don't. That's not where it has to come from. So
it's also. I mean, even like governments have gotten confused about this, but like an embryonic stem cell means you're getting a stem cell from the moment conception comes into place. That's what an embryonic stem cell. Believe it or not, you can actually harvest stem cells from things like the placenta, umbilical derived, those are actually adult stem cells. So even though it's a brand new baby, or it's the kind of combination of mom's blood and baby's blood, those are actually adult stem cells. But for the sake of this discussion, right, we're not really talking about embryonic stem cells. What we're talking about are autologous stem cells, and specifically we're talking about autologous stem cells or mesenchymal stem cells. And generally speaking, we can get those from the bone, we can get those from fat, we can get those from blood. What we're going to talk about today are specifically mesenchymal stem cells that we get from bone marrow.
Okay. And I guess and please correct me if I'm wrong, but some of the older beliefs, I think we've kind of refined our beliefs now, but were that the stem cell was sort of like this baby cell that hadn't decided what it wanted to be when it grew up, and that when you placed it in certain areas, it would become whatever the tissue in that area was. So for instance, in the knee, it might become cartilage, but I think that's become more nuanced and refined since then.
It's kind of interesting, the sort of the evolution or the discovery of what they do is part of what you said may be true, but they really act as master conductors, if you will, or even like general contractors. So they're recruiting all kinds of regenerative cells into the area to start helping with repair. So certain types of anti-inflammatory cells, certain types of regenerative cells, certain types of growth factors to all move into the area and help with repair of the damaged tissue. And we'll talk a little bit about what that means in terms of, like, I'm sure we'll talk about PRP and exosomes and some of these kinds of things.
Okay, so we got the basics, and mesenchymal stem cells tend to be the star of the show when it comes to orthopedics.
Yes.
So joint injection stem cells, et cetera, tendon, ligament, meniscus, synovium. Okay, and so like you said, they're sort of the conductors or the general contractors that call in or signal to other cells and kind of act in communication with other cells for healing factors. Okay, and is it more anti-inflammatory? So how does that work exactly?
Yeah, well, I mean, we'll get into that, but I think one of the advantages to Regenexx is that they have 21 years of data and literally hundreds of thousands of case studies, and so sometimes you can inject into a microenvironment that's way too pro-inflammatory, and that's not going to be good for the regenerative cells. Sometimes you inject into an environment that's really good for the stem cell. But generally speaking, stem cells are regenerative, number one, and then anti-inflammatory, number two. Of course, one of the things that we're going to talk about is an entire program where we can actually take patients and create or better create a metabolic milieu that increases their chances of success. And there's a whole set of talking points and topics that are worth exploring in that realm. But generally speaking, they're anti-inflammatory and regenerative.
And then as far as kind of newer frontiers or words that I see tossed around that I don't fully understand, and I know a lot of our patients ask us questions, exosomes. They ask about PRP. A lot of times stem cell is combined with PRP. Can you explain or elaborate a little bit on that?
Absolutely. So stem cells, mesenchymal stem cells, are separate from what's called platelet-rich plasma. So PRP is really interesting. PRP has been around, or the actual therapy has been around probably even for a little longer than our knowledge of mesenchymal stem cells. But platelet-rich plasma, we've known for, if you look at blood, just generally speaking, you have red cells and white cells, and then you have plasma. And within your plasma, you've got different types of antibodies, you have different clotting factors, you have different proteins, and you have platelets. And so what you can do is you can pull out a patient's venous blood, and then you can spin it in a machine called the centrifuge, and you can spin it in such a way that you pull out the red cells and the white cells, and you're left with plasma or platelet-rich plasma. And what's happened, like we've known for 2,000 years, that when you bleed or you have a trauma, the blood will clot. We've observed that for, since ancient times. What's happened with the evolution of the electron microscope is we now know that when that happens and there's bleeding and trauma that occurs and there's clotting factors that move to the area, that platelets recruit other types of regenerative cells to help to repair that damaged tissue. So if you pull the platelet-rich plasma or the blood out of the plasma and then you extract platelet-rich plasma from your centrifugal process, this platelet-rich plasma has regenerative properties. And so what's interesting about PRP is a platelet is that when it is in when it is moved into that environment, it releases what are called alpha granules. And alpha granules, anywhere from 50 to 80 alpha granules are released from every platelet, and these alpha granules are absorbed by these other cells that are damaged, and these alpha granules have all kinds of regenerative properties associated with them. And then the other thing that is associated with platelet-rich plasma are different types of growth factors. So you get things like vascular endothelial growth factor for the formation of new blood vessels. We call that angiogenesis. You get like fibroblast growth factor. You get epidermal growth factor. So you get release of all of these different growth factors that help with regeneration of the damaged tissue. So you get the way to think about it is, generally speaking, is it is regenerative. It gets you get alpha granules, and then you get the movement of a lot of these different growth factors, which are anti-inflammatory and regenerative as well. So when you combine the platelet-rich plasma with the stem cell product, a lot of times you get a synergistic effect. Now, this is differentiated from an exosome. And exosomes are really interesting because they're part of the stem cell milieu. So stem cells will release exosomes into circulation, and exosomes have they're really interesting little molecules. They have microRNA, okay? They have lipids, they have proteins, and what they do is they're also absorbed by the damaged cell, and then those messengers that the exosomes are releasing then tell that cell to start repairing itself. So it can absorb different microRNA factors that then tell the DNA to start upregulating different repair factors. And so these exosomes are highly, highly regenerative and highly reparative, and they're associated with the stem cell regenerative milieu. And this is kind of the whole thought behind the exosomes.
So let me understand. So if a stem cell is in some way like a contractor, then the exosome is sort of like a blueprint. It sort of gives the directions in some way.
Somewhat, yeah.
Okay.
I mean, there's a lot of different things going on, but I would describe the exosomes as the line, the foreman or the line guys doing all the work, going in there and telling the cell exactly what you need to do to repair itself.
Gotcha.
And every stem cell is releasing exosomes, and these exosomes are little packets, and they're absorbed by the damaged cell.
Okay, so the exosomes, oh goodness. Okay, I'm so excited about this topic. So the exosomes are not necessarily something that's injected per se, because like when you're doing a stem cell procedure, you're extracting stem cells from the person.
Sure.
Whether it's bone marrow derived or, like you said, fat derived. The exosomes are part of that process within the stem cell.
Correct. Yeah. Anytime you inject an autologous mesenchymal stem cell injection in a patient, you're injecting with that mesenchymal stem cell, you get exosomes with that.
Okay. All right. Just wanted to make sure I understood it. So what about the right person? I mean, is there such a thing? Like, can you just like do stem cells on pretty much anybody?
Well,
you know,
it's interesting. I mean, the field It's like any new technology. There's a lot of excitement. And I think just to back up for a while, if you think about osteoarthritis in the United States, I think it's 32 million Americans are affected with osteoarthritis. I think it's the number one cause of disability for Americans over the age of 50. Right now, the non-surgical treatments that we offer for the most part are things like non-steroidal anti-inflammatories, corticosteroid injections. So rightfully so, there's a lot of excitement about stem cells. Unfortunately, and just like anything, we sort of have to balance our excitement and our need for this treatment with, okay, how do we make sure that it's appropriately regulated? How do we make sure that it's safe? How do we make sure that and of course there's going to be gray, right? And there has been gray over the last 20 years. One of the great things I think about Regenexx is that they've got 21 years of experience, and with this they have a gigantic database. And so they can basically, and they also will tell you, hey, if it's a certain degree of osteoarthritis at this joint, we're not supporting it because the data doesn't show that it's going to get better, right? So you might have, severe osteoarthritis in the ankle, and they're going to say, hey, this is not something that we support.
Gotcha.
So they won't cover that.
It's outcomes based.
Yeah, it is outcomes based. And now, because they've got hundreds of thousands of patients, they know, or they have a reasonable idea that, hey, if we do a PRP injection in this shoulder with this level of arthritis, your chances of improvement are in the range of 50 to 60% based on tens of thousands of patients we've treated in this range. And I think that's important because patients a lot of times want an answer. Of course, there's never 100%, there's never 0%.
Right.
But patients want to, especially if they're going to invest and they're going to take the time and they're going to go through the process, they want to know, what are my chances of success? And of course, as physicians, we can never say, hey, your chances are 97% or whatever, but we can at least give them a reasonable range. And because of their process, because of the way that their entire program, we know that it's safe. And we know based on hundreds of thousands of patients that have been treated that it's safe, which is the most important thing.
So injecting into the right environment matters,
Correct.
obviously.
Yep.
That's probably why it's kind of a no to give a patient, or to have, you have to wait for a washout period, right? If the patient's been on steroids before you inject, I think they call it a washout period. Because you can't have this, you need some of what occurs with the injection. If you throw in steroids or have steroids in the system, it's going to kind of hinder some of the inflammatory reaction.
There's all kinds of protocol with their program. So you're exactly right. There's a certain amount of time that you have to wait. After a corticosteroid injection, there's a certain amount of time that you might have to wait if you've got active synovitis, or you've got active swelling, or let's say. And like I said, even before, even if you've got degrees of osteoarthritis in a particular joint, and if that joint, for instance, is bone on bone in a certain joint, they may say this is too severe, and the outcome data here doesn't support us doing this, right. Which I think is great. I mean, it gives us a lot of clarity on our outcomes and what we can actually advise patients on.
Right, and I also think osteoarthritis is often like, oh, it's bone on bone, it's bone on bone. It's like, it's an inflammatory process, and that turns into a chronic issue.
Right.
So.
Right. And I do think, going back to it, in our philosophy at Ikaria is that we want to understand root causes of disease processes. So we're looking at cardiometabolic health. We're looking, obviously, our big ticket item is insulin resistance, hormonal optimization. We're looking at gut health, brain health. We want to understand tox burden, so we want to understand metals, environmental toxins, molds, and if there are things going on, we want to make sure that those things are improved. And then, just looking at some of the conventional therapies it's all cyclic, right? You've got let's say you have bad knee pain, or you got bad shoulder pain. Let's say you stop moving, you stop doing whatever it was that you did to work out. Well, now you're not working out as much. Now you're gaining weight. Maybe you're depressed. Maybe you're not sleeping as well. Maybe your diet's starting to take a turn for the worse. Maybe your consumption of alcohol goes up. and all these things start to compound on each other. And so one of the things that we really emphasize is not just, picking the right environment, which we're so happy to partner with Regenexx to advise patients correctly on, but also making sure that when we do work with patients, we're working with an entire program. We're not just, hey, here's your injection and, here you go home, that's it. You and I have talked about this at length. Our dream is to take the functional piece, all this functional or longevity, all it is hyper prevention.
Right.
We'll take that piece, this integrative approach to medicine, and then fuse it with the conventional. I see this all the time as an anesthesiologist, like how often we're operating on patients that are not the best or are inflamed or have they're quote optimized, but they have a CRP of 3.5 and they've got a fasting insulin of 15 and an ApoB of 110.
Not severe, but not great. Not optimal.
They're not optimal. And so what we want is a patient that is, optimal. We want to harvest the soil. When we harvest that soil, we want it to be optimal. And when we do the injection, we want it to be optimal. And when we talk about the rehabilitative process, we want that process to be conducive to healing as well.
Yeah, I often talk to patients about being the best version of you. Okay, so if I have a patient, she's 45% body fat, I'm not necessarily trying to get her to 17% body fat or her abs show. I'm just trying to get her to the best version of her. So when you talk about optimizing a patient for stem cell therapy, that doesn't mean they're going to be perfect without any issues whatsoever. But you're going to take them and go, okay, I'm dealing with an environment that may not respond. The stem cells may not respond as well in this environment. Let me take this environment to the better level or the next level, okay, so that I really give these stem cells a chance to really work. So I've always looked at them like seeds. You can plant a seed in crappy soil, okay, nutrient deplete soil, or nutrient dense soil. Which seed is going to do better? The nutrient dense soil, okay, with water and sunlight and all those things. So we're just looking at the person as, okay, let's optimize your environment so that when we do this stem cell injection, it's gonna work. You're going to have benefit from this.
Absolutely, no question about it. I think that in fairness, Regenexx does a good job of there are a couple different areas I think where obesity, it turns out, really doesn't make much of a difference. But I do think overall, even if we're saying, okay, here's your stem cell injection, I think overall we still want to create a set of habits and build out these longevity lifestyles, starting with diet, exercise, sleep, stress. Of course, you and I hate the word diet. Lifestyle with the way that you eat,
eating.
circadian alignment, mitigating stress, and then if we need to add things like hormonal optimization, a real defined gut health program, some of the different longevity stacks that we get into, but all of those things. I think that if we do that and then we do the injection, I just think overall we're benefiting the patient, and then we're creating if the joint gets better, now we've created lifestyle habits, we've created a metabolic milieu, a gut milieu, a weight loss milieu where now they feel better, they want to move around, and so it contributes to the overall functionality of the patient. And in the long term, we're doing our job as far as not just treating the joint, but thinking about overall prevention. And again, we talk about this all the time. We don't dictate when the good Lord calls you home, but if we're doing our job, we can significantly increase the chances that when that day comes, you've been functional your entire life, which is kind of the goal, right?
Yeah.
Unfortunately, all of us are going to die, but when that day comes, we want to be functional all the way through. And the science is really there to support doing that.
Yeah. And we talk a little more about Regenexx, just kind of who they are, et cetera. I know we tapped on it, but just to get a little deeper, I'm pretty excited about them, that you're chosen, you had to apply. It's pretty selective process. I mean, not everyone gets accepted by them. They're pretty picky, which I really like in a world of everything's very sexy, hormones and peptides. And this is a company that's like, no, we're pretty exclusive and we're pretty choosy. And because they don't want their brand diluted, they really have a good product. And so just, if you don't mind, just elaborate a little bit on who they are and maybe who they're not, the things they're against.
So they've been around since 2005. They have a really, really nice program. They do a great job of, taking physicians through and really taking your team through of the whole harvest process. They do a good job of educating. And I think the other part that I really, really thoroughly appreciate is their emphasis on establishing the right diagnosis. So, using imagery, using ultrasound, X-ray, MRI, establishing the right diagnosis. And then once you've established that diagnosis, establishing a real understanding of whether or not this patient's actually going to be an appropriate patient or not. And then if they are an appropriate patient, making sure that the physicians they've chosen have the skill set to go ahead and do the actual extraction and the injection under real-time image guidance, which so that you know what you're injecting, which is hugely important. And it is important in this space because there are a lot of, quote, stem cell clinics out there, and I think it's just important to make sure that you're choosing a product that has proven success and a proven track record. And I think Regenexx has the gravitas to demonstrate that.
Yeah, so a consumer who's not really sure, not saying they have to go through a Regenexx doctor, but they should know the right questions to ask, because this blanket statement of stem cell injection is like, what you should be asking. What are you injecting?
The right questions to ask, and then track record, and then who you're dealing with. And they're, Regenexx certainly doesn't have the monopoly on this, but they, like I said, they have a huge database, a proven track record, a very reasonable selection process with their physicians, and a very applicable and logical process with extraction, diagnosis, decision-making, extraction, and then injection.
Right, so they kind of have
under
a
image guidance.
Proprietary processing protocol and approach that is important.
Yep.
So these are just things you really, if you are going to get stem cell, you got to ask these questions.
Right.
So can you take us through the process of getting a stem cell? So here's me. I've come in. I'm telling you, I have osteoarthritis of my left knee. It's been going on for 7 years. I'm just not getting relief. I've tried all the conventional approaches and nothing has helped. I'm at the level of, I'm at my wit's end and I want stem cells. So
Sure.
What would the process look like for me?
Right, and I'll take you through the Regenexx process, and then kind of how we, I think, supplement what we kind of the way we want to think about it. So. And I love Regenexx because the first thing is you get a thorough history and physical, right? And as part of that physical, I need to look at the knee that we're dealing with, and then I need to look at the joints surrounding that joint. So if it's your knee, I need to look at your ankle, I need to look at your hip, even look at your lower back, make sure we're not dealing with any radiculopathy.
Right.
Just do a really good, thorough history and physical. What types of medications the patient's taking, what types of surgeries, what types of drug allergies, what are you putting into your body, all those things, and then probably imagery, right? So at whatever, depending on what joint we're dealing with, we're going to establish a diagnosis. And let's say we have knee, and let's say we have moderate osteoarthritis, and let's say they're they're an employee of a company that works with Regenexx. And in that situation, Regenexx is then going to say, okay, this is the degree of osteoarthritis. Based on this, we think this patient is a good candidate. Let's say you have mild to moderate osteoarthritis to the knee, and Regenexx says this is a good candidate. Let's go ahead and we can green light the mesenchymal stem cell injection. At that point, what we would do is it would be probably about an hour process, but we would we would do the bone marrow harvest. We would then.
Where do you take it from? What part of the body?
The iliac crest.
Okay.
Yeah, it's very simple. It doesn't need anesthesia.
Hip area.
Yep.
Okay.
Very simple, very painless. It doesn't need anesthesia, maybe a little local. Mm-hmm. It's very quick. And then we do the harvest. And then after that, depending on the diagnosis, we would then take the mesenchymal stem cell and we would inject it into the area of the knee that has arthritis or whatever the diet. Like say you've got a medial meniscal tear, say you've got a medial collateral ligament tear or whatever, we would inject, whether it be PRP or something else, into that area under ultrasound guidance.
Okay.
Real-time ultrasound guidance.
So a combination.
Now, right, with us, and what's cool about Regenexx is they require at least 45 minutes with the patient, which I think is super cool. What's cool about what we're going to do is, in addition to that, we want an entire functional program. So we want to do what we do, which is do a full-on, not just that, but our 50-question intake about different systems in the body, and encourage patients to go ahead and get not just your conventional labs, but advanced lipidomic profile, get a metabolic health profile, maybe a couple markers dealing with inflammation, MTHFR, and then put together an entire way of eating, an entire way of movement, both before and then after your injection, and then also put together an entire health optimization program. So get that going. And then we also have, and again, we qualify this is not part of Regenexx. This is not what they require. It's separate. But the other thing is we also have a lot of different longevity stacks that really have some pretty outstanding data associated with them.
Yeah, so that's just our own thing.
Right.
Ikaria's proprietary blend.
Yeah, right.
That we just see just enhances your ability to receive the stem cell well and to have a good outcome. A couple things I meant to ask you. So without using like ultrasound guidance, I've understand that the accuracy, the intra-articular, meaning inside the joint accuracy, goes down by like 60-70%.
It's almost huge. Not even, I mean, there's no excuse. The standard of care now is
with an ultrasound
and or fluoro. And if you're doing it under ultrasound confirming with fluoro, so that is the standard of care. Ultrasound more and more is so useful and so good that there's really no excuse to not use some type of real-time imagery to make sure that you're injecting into the joint that you say you're injecting into. And so, so that's pretty straightforward.
That was one question. And I meant to ask you, with the platelet-rich plasma, with the PRP, there's something to do with white blood cells, like that Regenexx is very big on being very low concentration of white blood cells inside that PRP,
yep.
Correct?
Okay. Yeah, you have leukocyte-poor PRP, and then you have leukocyte-rich. So when we spin blood down, we can get a super high concentration, or you can get a lot of red cells and white cells, especially when you're harvesting from bone marrow. And so red cells and white cells are very, very pro-inflammatory. So when you inject, it can decrease the regenerative properties or the anti-inflammatory properties of the PRP. So the goal is to get leukocyte-poor PRP, and I think Regenexx has a very proprietary process under which they get that leukocyte-poor PRP.
So less white blood cells in the PRP, the better.
Yep.
Okay. All right. So the better the outcome, I guess. Can we talk, and I don't want to jump out of the Regenexx process and all of the things you're walking me through it, but I'd love to know some of the adjunct therapies that we do, like Ikaria does, that just kind of help accelerate the process of healing.
Well, one of the things is there is the guy is out of University of Pennsylvania. The scientist was Tom. Boy, I forget. I can't remember. Do you have? I think we wrote it down.
Did you? Oh,
University of Pennsylvania. But he did a study where he did 20 treatments of hyperbaric oxygen, 2 hours each treatment at 100% FiO2 in 2 atmospheres. So just to take the audience through, when we breathe room air in Florida, we're breathing 1 atmosphere of oxygen at 21%. So just like liquid or just like a solid, gas has a certain percentage of different gases within it. So our air has 21% oxygen. So with hyperbaric oxygen, we go up to 100% oxygen, and we go up to 2 atmospheres. And he was able to demonstrate, if you did 20 sessions at 2 atmospheres and 100% FiO2, and you did that 20 times, he got an 8-fold increase in stem cell yield.
Wow.
Which is incredible. And so what that means, how that works is when we do the hyperbaric oxygen, there's something called a hypoxic inducible factor. And hypoxic inducible factor is what we call a transcription factor. So what that will do is it travels to the DNA and it binds to a certain binding domain in the DNA and then tells DNA to make certain things. Like, so for instance, when we exercise, you get upregulation of what's called NRF2. NRF2 is a transcription factor that binds to what's called antioxidant response element, and that increases production of things like superoxide dismutase, catalase, glutathione, which are your antioxidants. With regard to stem cell, what happens is that in hyperbaric oxygen, hypoxic inducible factor is upregulated. It binds to a certain part of the DNA binding domain, and it stimulates what's called stromal derived factor and stem cell factor. And these two guys are interesting in that, and this is a damaged cell or a cell that's been exposed to high pressure oxygen. It then travels outside of the cell and sits outside of the cell, and a stem cell has on it a beacon, if you will, or receptor site called CXCR4. It's a complicated name, but it's like a little beacon, and it's looking for these stromal derived factors and these stem cell factors. And when it finds them, it binds to them. And what happens is that binding then upregulates the proliferation of more stem cells, and it also protects the stem cell from actually dying. And so that's the mechanism behind it. And what he was actually able to show is there was an 8-fold increase in stem cell proliferation after the hyperbaric oxygen therapy. So, and what we would like to do with our patients is, before we do the injection, we expose you to our hyperbaric oxygen protocol. There's another physician scientist out of Israel by the name of Shea Efrati, Efrati, who's done a ton of data on hyperbaric oxygen. He does it a little bit differently to get more of that hypoxic inducible factor yield, which is, he's got a lot of really, really good studies. So we have a way of doing it, but we take our patients, we optimize the metabolic milieu, if you will. We optimize the gut milieu. We optimize the patient. We get them moving in the right direction, diet, exercise, those kinds of things. Do our hyperbaric oxygen, harvest the stem cell after the hyperbaric oxygen, and then do the injection. And then after the injection, do more hyperbaric oxygen. And so the whole goal is to not just improve the joint pain, but improve the overall health and well-being of the patient, and provide a new outlook, if you will, on the patient, so that they can improve their functionality and the goal, improve not only their longevity but also their health span
and their life, like their ability to move around and be pain-free or less pain, just less pain. So the hypoxic
inducible factor.
Okay,
yep.
It seems like a misnomer to me, because you're sticking someone in hyperbaric oxygen, which is a lot of oxygen, 100%.
Yeah.
So why that term? It's a little odd to me.
And Efrati seems to think that the HIF is stimulated not by the actual exposure to the high levels of oxygen, but when the patient gets done.
Oh, so they're going from 100% oxygen out of the HDO chamber to 21%.
Which is room air, but then it's a relative hypoxia.
To the body.
And so what is interesting is Efrati will actually, during the protocol, he's got a couple things where he's got like a study where he increases telomere length. It's there. It's a 37% increase in telomere length.
Whoa.
He's got some improvements in cognitive impairment post-stroke. He's got PTSD in Israeli veterans that he's had success in treating. And his general overall protocol is that he'll do a 90-minute treatment, but at 20 minutes he'll take the patient. He'll keep him at 2 atmospheres, but take the patient from 100% FiO2 down to 21% FiO2. And even though that's not really a hypoxic exposure, it's a relative. And so the thought is that it tricks the body into releasing more hypoxic inducible factor, and that little factor then travels to the binding domain of the DNA and stimulates a lot of different things. But for the sake of stem cell, it's stromal derived factor and then stem cell factor. And those are the things that the outside of that stem cell is looking for to then bind and proliferate and then help the existing cell that's calling out for the stem cell.
I'm about to get on a tangent, but I'm just so curious. This is going to seem like a dumb question, but we're going to Denver. Are we going to have like a relative hypoxic event?
Probably,
I mean, well, here we are, sea level. Now we're going up. I mean, every person who knows we're going there is like, are you prepared? Are you going to get sick? And I'm like, God, I don't know. Maybe I will. I don't think I've ever been at that altitude.
As long as we don't run a marathon, I think we'll be okay. But like, Mile High definitely for Floridians is way up there.
Yeah,
We think North Carolina's high.
I just curious. I mean, you may not know this, but have they done any studies on that? Like just people going from sea level to that? Does it increase that transcription?
One of the tools or longevity devices that we're interested in purchasing is something called intermittent hypoxia therapy. And my understanding is that originally was developed by the Russians during the Cold War era, and they were trying to take their athletes up into these mountainous regions, and some guys would respond really well, but other guys were disasters. They'd get horribly sick, and nobody really knows who or what or when you're going to get sick. And so what they did is, in order to avoid that but get the same results, they invented this intermittent hypoxia therapy where they take patients from 21% FiO2 and then take them down to like 10% FiO2 and then back up to 21 and then down. So you kind of vary the degree of the hypoxic exposure. We tried it before. Yeah, it is really super cool.
We don't have it here yet, but we did try it. It was really cool. And you're kind of, an adrenaline junkie, in my opinion. But by the way, anyone who doesn't know, anesthesiologists usually by trade are adrenaline junkies. They love like that kind of risky feel. I don't. Family practice doctors are usually more chill, relaxed. They don't like a lot of risk. And Brett, when we were doing the IHT, he would stare and watch as he deoxygenated. I personally would not watch. But what I would feel was like a sleepiness come over me. Like I would feel like, I'm about to fall asleep because I was essentially deoxygenated. It's kind of, wearing a mask. It's very interesting.
It's pretty interesting too, the fact that humans tolerate hypoxia much better than we tolerate hypercapnia, which is high CO2. That's what makes humans want to breathe. And hypercapnia is actually a lot of times not bad for humans. Obviously, hypoxia for long enough will kill human. That's kind of the whole danger behind we call shallow water blackout when we're free diving is you can get the hypoxia doesn't bother people.
But the high CO2.
The hypercapnia is what makes people want to breathe, but hypercapnia won't hurt you. Hypoxia will kill you.
Yeah.
So it's pretty dangerous.
It's really interesting. I don't know. I'm sorry I got on a tangent there. So basically the concept is here what we do is this integrated protocol where we're really optimizing the person sitting in front of us for the stem cell procedure, making sure they're a good candidate, optimizing hormones if we can, metabolic function, reversing insulin resistance, optimizing vitamins, and then have this approach where we can put them in the HBO chamber for multiple sessions prior to their stem cell. And I don't think I'm not trying to toot our own horn here, but maybe I am. I don't think there's a lot of people doing that.
Well,
I mean, I'm sure there are some.
I think it's a tremendous. I think it's a tremendous partnership because I really love the experience, the program, the selection process that Regenexx has. I love the requirements, all those kinds of things, like you said, the patient selection. And then I think if with the right patients, when you add, and again, they're separate, this is not part of the Regenexx protocol, but when you add the things that we like to do for patients, all of the things that you just mentioned and our emphasis, I really think you're looking at a program that can be life-changing for patients and is kind of a paradigm, it is a paradigm shift. It's not, hey, here's your corticosteroid and NSAID, keep doing what you want to do, and then eventually you'll have surgery that is debilitating and obstructive to your life and all those kinds of things. This is, hey, we want to change your life. We want to change the lifestyle habits that have led to this. We want to help you with all these different things so that when you are a great grandfather, you can walk with your great grandson, or you can walk on the beach, or you can go fishing when
Right.
you're 80 years old. These are the things that we want to do. These are the things that we think about
Yeah.
when we're dealing
And
with
we're
patients.
I mean, it's really important, and this goes outside of stem cells. For us at Ikaria, it's really important that we are outcome based. I mean, I don't want to take anybody's money. Yes, this is my job. This is how I pay the bills. Yes, it is. However, nothing will deflate me more than having someone give me money for something like a stem cell procedure and then not seeing them see some sort of improvement. It really, I mean, I know for the two of us, it destroys us. We're not happy with that. You know,
Well,
it's
what
not
do we
acceptable.
tell what do we tell all our workforce at Ikaria? We say patient outcomes are our lifeblood.
Yep.
So whether you're calling for, to get insurance approval or whatever, that patient's outcome, that is our lifeblood. I had 2 patients today that basically said we've changed their life.
Yeah.
And we've said this all the time is you spend so many hours and so many years studying and working and doing all these things. If you can change the outcome of one patient because of the things that you know and the things that you've done, that makes it all worth it.
Yeah.
You know?
Yeah, I agree. So, and then, and kind of to wrap it up here, there are other things you can use stem cells for, not just joint regeneration and repair. I mean, there's, you name it.
Sure.
They're using it with Alzheimer's. They're using it. I think I saw something with a woman who was paralyzed. I mean, really remarkable things out there that they're utilizing stem cells for.
Sure. And I think for the sake of this discussion, primarily what we were talking about is osteoarthritis, but there are lots of anti-inflammatory uses for stem cell. I think that fortunately, it seems as though the country or the government is becoming more open to one thing we didn't talk about, which is culture expansion. I know in places like Panama, there are other. I think Mexico, you can actually take stem cells and then culture expand the stem cells. Whatever type of stem cell you're dealing with, and so I think there's a new frontier of medicine that is out there. And yes, I think that there are there are a wide range of potential uses. Don't think the research is there yet, but I think it's rapidly progressing.
Yeah. And then we always talk about kind of the art of healing, but the reality is part of the art of healing is kind of helping your body heal itself.
Correct.
Because it was designed to do that.
Right.
And so we act like, regenerative medicine, it's this new frontier. It's like, it is really the way the body was designed.
Yeah, I think
we're just helping it along.
I think sometimes in medicine, we sort of have this idea that we're going to create something, whether it be a pharmaceutical or a surgical intervention or whatever, and then somehow that's going to lead to the patient having, a great outcome. And sometimes they do. I mean, there are certainly, there's places for pharmaceuticals and surgeries and all these kinds of things. But often I think we forget about how do we actually restore the engine? How do we actually restore the anatomy? How do we actually restore the way the body is actually supposed to work?
Exactly.
When we think about insulin resistance, we talk about how it's upstream from all of these different non-communicable diseases, not just type 2 diabetes, but vascular disease, most forms of dementia, probably upstream from cancer, certainly is a metabolic milieu under which cancer can proliferate and grow. But we talk about insulin resistance, really you're getting at the core of mitochondrial dysfunction. So if you can restore how that engine actually works and you can restore mitochondria function, then a lot of times all these other things improve. And so that's kind of the whole thinking with regenerative therapy. And I'm excited about what we're doing. I'm excited about partnering with Regenexx. I appreciate the selection process and what they require their physicians to go through. And I can't wait to just to provide this for our patients.
Yeah, I'm really excited about it too. I think just in general for patients out there considering therapies, regenerative therapies, and in particular stem cell, just make sure you ask the right questions. It's always nice that it's done cohesively and part of a program, in my opinion. I just think that's, the whole picture. It's not one piece to the puzzle. It's all pieces.
Right.
to put
And
together a
I think
puzzle.
just to close, if we could, if there's a couple main points to close, one is we're cautiously optimistic about the future of regenerative medicine. Two, as the consumer, know who you're dealing with, have, ask them for an understanding of what the outcomes are and what their database looks like. And ask them about their process, require them to, do things under image guidance, real-time image guidance, and then ask about their full program, ask about how they're going to integrate in their entire program and what their understanding of things are. And just, I think consumers drive excellence, and I think just demand that excellence. And I think the future is really, really bright with regard to this emerging technology.
I agree. I think that was great. And hopefully after Denver, we'll even have more knowledge in this field and be able to share it with you guys.
You got it. Thanks for listening, guys. We will see you next time. Enjoy your summer, and we'll see you next time.
Thank you.
Thank you.